we have Jen Calimon joining us live from Malabon. Jen, hi. What measures are currently being undertaken, to detect or maybe track or monitor the entrance or the presence of the Omicron variant here in the country?
Hi, Sean. As what DOH Undersecretary Maria Rosario Bergeres said, we cannot 100% control or prevent the entry of Omicron variant. So what we are doing is we are buying time to delay the possible entry of this Omicron variant. Part of what they are doing is monitoring the entry of for the entry of this Omicron is intensifying our biosurveillance. Bergeres also urges LGUs to continue doing its active case finding and testing for those who are exposed and those who have symptoms, so they can immediately track in case Omicron variant will be detected in the country. Sean?
Hi, Jen. Do we have any updates on the genome sequencing of samples here in the country, as well as monitoring of close contacts of those 3 travelers coming from South Africa?
Yes, Sean, the DOH is still closely monitoring the 3 individuals from South Africa, Burkina Faso, and Egypt who tested positive for COVID-19. We are still awaiting for the results of the samples submitted to the Philippine Genome Center. So far, Sean, there are 253 individuals being monitored by the health department, and the back tracing and contact tracing efforts are still ongoing. On the 80 contacted or verified patients, 71 are currently in facility-based quarantine, 4 are in home isolation, and 5 are already discharged. Sean?
Right, so at the moment it is December 6th. Jen, what is the most dominant variant from the latest run of genome sequencing that they have administered? Is it still the Delta variant?
Yes, Sean, based on the latest run of genome sequencing on the 19,305 samples with lineage, the most dominant variant still is the Delta variant at 40.65%. This is followed by the Beta variant at 18.75%, Alpha at 16.36%, and Gamma variant at only 0.02%. Sean?
Right, we also have NEDA Chief Carl Chua suggesting a change in metrics, at least with COVID monitoring. What does the DOH have to say about this? Of course, Secretary Chua says to focus on severe cases and hospitalization rates as well as deaths.
Well, USEC Maria Rosario Bergeres said that they have been talking and thinking about this long before this pronouncement by NEDA Chief Chua, but there are a lot of factors that have to be considered before doing this. Major consideration, Sean, is the vaccination status. The DOH wants to see first who else can get infected by the virus once more people are vaccinated. So once we reach our target coverage for vaccination, then maybe that is the time when we can transition into looking only to the severe outcomes only, according to Bergeres. Sean?
Right, and having said all of this, Jen, what is now the COVID-19 risk classification of the Philippines and majority of the regions? Is it true that we are now considered low risk for COVID?
Well, so nationally, and majority of the regions are at minimal risk case classification with negative 2-week growth rate at negative 57% and low risk average daily attack rate at 67 cases per 100,000 individuals only. Our national positivity rate is only at 1.80%. NCR has the lowest rate at 1.10%, followed by regions 4 and 7 at 1.20%. Only regions 2, 4B, and 9 have more than 5% positivity rate, but it is continuously declining. In terms of bed utilization, Sean, our national bed capacity remains at low risk at 21%, and the national ICU capacity is also at low risk at 26%. Sean?
Thank you so much for giving us all those updates. Jen Calimon reporting to us live from Malabon.